Every day in my practice, I'm hearing from loads and loads of parents that are worried about their child getting a fever in the time of coronavirus. And so, what I hope after this video is that you feel comfortable and confident and have a plan for if and when your child gets a fever. Now, fever causes a lot of worry at baseline. Parents have been trained that fever means something's wrong. It means that there's an infection going on, something that we need to do. And so parents often worry when they feel that warm child and they get out the thermometer and take their temperature. And then in this time of coronavirus, when all we are being bombarded with is news about coronavirus, it's so hard to not worry that the next time you wake up, you hear your child crying at night, or you go into their room or pick them up and they feel really warm and then they end up having a fever. What are you supposed to do? And so when I talk with parents about fever, I talk about it in a couple of different ages. And as you go through this, I think the most important takeaway message is, first, if your child gets a fever, don't freak out. And second, talk to your child's doctor, because your child's doctor knows what's going on in the community, what's going on with coronavirus and other respiratory illnesses and non-respiratory illnesses, and can help guide you in what to do. Now, I break it down into really 3 age groups: the under 1 month age, the 1 month to 3 to 4 months age, and then the 4 months plus age. And as I go through this, take what you want from each of those ages, but really that's where the breakdown comes from me. If your child has a fever, and by fever I mean a temperature, in that age group it's a temperature taken rectally of 100.4 or greater. So you take their they feel warm, something's not right, you take their temperature, a rectal temperature of 100.4 or greater is going to be a call to your doctor's office, and they'll either direct you, come into our office and we'll begin the evaluation, or they'll direct you to the emergency department. And that's an appropriate time to go to the emergency department if for some reason you can't get a hold of your doctor, because a fever in under a month of age, a neonatal fever, is something that we take very seriously, and we'll do a full workup including blood cultures, urine cultures, which means collecting urine, and spinal fluid cultures, meaning that we'll have to do a lumbar puncture to remove a bit of spinal fluid, and then we'll probably watch your child in the hospital on antibiotics until those results come back. So under 1 month of age, you're going to call the doctor, you're going to head to the emergency department to get evaluated. In the 1 month to 3 to 4 month range, fever is still very worrisome to us because young children at that age don't have a fully developed immune system. They haven't been vaccinated against all of the illnesses that can cause serious bacterial infections and viral infections in childhood. And so in that 1 to 3 to 4 month age range, you, again, should not panic if your child has a fever, but I want you to call your doctor's office and talk through with them what to do next. Oftentimes, if it's that age group, we'll either say, yes, you need to go to the ER based on the other symptoms that they're having, if they're having difficulty breathing or dehydration or other concerns, or we'll evaluate you in the morning and decide what to do from there. So if they're in that 1 to 3 or 4 month age range, I want you to, again, call your doctor, don't panic, and then make a plan from there. Now, in the age group that's 4 months of age and older, again, I want you to remain calm, but in this age group, the likelihood of serious bacterial infections in children that are up to date on their immunizations is lower. Their immune systems are more robust. And so what we can do is look at what other symptoms they have going on. If they're otherwise breathing easily, eating decently, staying hydrated, we can treat their fever and closely watch while communicating with our doctor's office. If they're over 4 months of age, it might be we'll call the doctor in the morning. We'll watch closely between now and then the doctor may say, okay, you need to come in and be evaluated, or continue to watch at home and avoid public spaces and outings and those sorts of things. In that age group, it's fine to use Tylenol to treat fever. Most of the time, instead of just looking at the number and treating the number, I say look at the baby and say, okay, this baby, this toddler is running around, playing happily, smiling, cooing, doing all the normal stuff for their age. Even though their temperature is 101, we're just going to let it ride. If, on the other hand, their temperature is 101 or even lower, but they're really fussy or irritable, it's fine to treat them with fever-reducing medicine. Under 6 months of age, Tylenol is the only fever-reducing medicine you should use. Once they're 6 months of age, you can use Tylenol or ibuprofen. There's no benefit to staggering them or overlapping the doses. just pick one. I tend to pick ibuprofen more because it lasts longer and has some anti-inflammatory effect, but both are fine choices. Now, a couple other points in this age of coronavirus regarding fever. Fever is one sign of illness. When it comes down to it, if you rush your child to the emergency department when they have a fever, hopefully before you go, you'll give them some ibuprofen or Tylenol, and you'll be sitting in the emergency department. The fever-reducing medicine will have started to have some effect, and by the time you get back and are seen, and after sitting in the waiting room and being exposed to all those other germs, your child will probably be happy and playful, and the people in the ER will, question why you're there. What is the emergency? And so I highly recommend, if your child is over 4 months of age and they have a fever, don't rush them to the emergency department unless they have other symptoms that are worrisome. Fever alone does not worry me. Fever plus respiratory distress, fever plus dehydration, fever plus unresponsive or decreased responsiveness, those are the things that I would be concerned about. Now, in coronavirus in particular, what we often see is fever and cough and kind of muscle aches and pains. And so those are what we're going to look for. And if we experience those symptoms and we're worried, talk to your doctor's office. Again, they'll know the local epidemiology and can advise you on come into the office or stay at home. And it will evolve over the next few weeks as we go through coronavirus. But my hope is that I can reassure you that fever is one symptom of illness. We have to look at fever in the context of the whole picture. Are they fevering but happy and playful, drinking okay, breathing easily? Then we can closely monitor at home. If on the other hand they have fever and difficulty breathing, or they can't keep down fluids, or they're getting dehydrated, or mentation or the way that they're acting is different, that's something where we need to take it more seriously and make more action. So again, remember, you don't need to run to urgent care or the emergency department simply because of a fever. Fever is one sign of illness, and hopefully this video has helped you to feel comfortable and confident that if my child has a fever, I know what to do, which is going to be to talk to your doctor's office, stay calm, treat the fever with an anti-fever medicine like Tylenol or ibuprofen as age appropriate, and look at the other symptoms of illness. Now, before you go, click the button below to subscribe so that you don't miss any other videos in this coronavirus checkup series, and please share it with another parent that's worried or unsure what to do. Keep up the good work.